normal scrotal fluid versus fetal hydrocoele. Normal scrotal fluid is a common finding. Once with the reported prevalence of 15%. In many cases, this is physiological and resolves spontaneously, either prenatally or shortly after birth. The description of physiological fluid collection is usually described on ultrasound as a crescent or half moon around the testis, while hydrocele is described as fluid collection that separates the testis from the scrotal wall and then distends the sac. And when it does that, there is likely to be circumferential. So when that is seen, it is no longer physiological but pathological. So this was 39 weeks these days, being prepared for repeat elective cesarean section. So let's look at the fluid collection around the testis here. So you see the testis here. Look at the crescent shape fluid collection here. And let's pay attention to the fluid collection around the other testis too. You see that? So crescent shape around the other testis too. So this is physiological. Postnatal scrotal ultrasound revealed that the tunica vaginalis normally contains 2 to 3 ml of straw color fluid, which is called physiological hydrocele. This patient is going for elective CS. So after the cesarean session, if one puts a probe, one will pick some fluid collection around what the tunica vaginalis, which will resolve shortly thereafter. So this is physiological. This was at 33 weeks. Look at both testes have descended. By 33 to 35 weeks of gestation, virtually 100% of testes would have descended into the scrotum. So here at 33 weeks, crescent shape. Crescent shape. No scrotal distension. No scrotal distension. So is this pathological or physiological? This is physiological. What about this? Compare the scrotal wall here with this. This is thin scrotal wall. Here you can see this thick scrotal wall, and even the raphe is thick. Why? Because this was a case of hydros fetalis with multiple congenital malformations. So this was a syndrome. And in fact, one of the earliest regions to pick for hydros fetalis is the scrotum. Remember that there are 2 phases of testicular descent, the transabdominal phase and inguinal-scrotal phase. Here you can see that the inguinal-scrotal phase is not completed. So this suggests that this pregnancy is likely to be less than 25 weeks. So here you can see the swollen testicular wall, the raphe, and even the phallus is swollen. Here you can see the wall is of normal thickness, the raphe is of normal thickness, but look at the testes pushed to one side and the scrotum is distended. So these two are pathological, while the preceding ones were physiological. So thank you very much for listening.